Welcome back. This is Basic Medicine Administration Training Part 3. Common medications, indications, effects, adverse reactions. While we'll be going over the highlights, you need to make sure you read the accompanying material because it's very extensive and it's important to understand the entire curriculum. On the drug monograph that is given out by the pharmacy with new medication ordered for the client, you will find the uses, side effects, and adverse reactions on medications. Here is a sample of a drug monograph. Cardiovascular medications. These medications treat heart and blood vessels. There are several types. Diuretics help eliminate salt and water, treats high blood pressure, congestive heart failure, and glaucoma. Vasodilators treat angina, chest pains, and high blood pressure. Antihypertensive. These drugs are to lower blood pressure. Antiarrhythmic treat irregular heartbeats. And anticoagulants prevent blood from clotting to reduce the chance of stroke or heart attack. Most side effects on cardiovascular drugs come from overdose. Report any side effects to the health provider immediately. Headache, nervousness, pounding pulse, weakness, flushing of skin, fainting, lightheadedness on standing. Warning: you must monitor the use of aspirin when using anticoagulants. This is because aspirin and the medicine will thin the blood, which can lead to bleeding. Make sure the client's PCP is aware of both when both are prescribed. Respiratory system medications. These are medications that are utilized to treat symptoms of the nose, sinuses, and lungs. Some of the types include cough suppressants. Some include expectorants, which are designed to break up mucus in the lungs and bronchi to make the mucus easier to cough up. Decongestants and antihistamines reduce swelling of the lining of the nose and dry up the mucous membranes. Bronchodilators, short and long-acting, these relax and expand the airway passages, most often given as inhalers or nebulizer solutions. Cough suppressants and expectorants come in the pill and liquid forms, both prescription and non-prescription strength. Note that a productive cough should not be suppressed. The body is removing mucus from the airways. Decongestants and antihistamines come in pills, liquids, and nose drops. Some of these are available over the counter, but are found behind the pharmacy counter and must be requested. Bronchodilators are used to open up the passageway when constricted due to asthma, reactive airway disease, or other such problem. Medications for the skin. Many of these come both over the counter and prescription strength. Except for some of the protectives, the topical medication should be applied thinly. No need to use a lot. Please review this list to understand these types of medications. Urinary system medications. Some of them include antibiotics that treats infections of the urinary tract, kidneys, or bladder. Some are diuretics to increase the output of water and salt, often given to maintain normal urine production for persons with kidney disorders. Urinary angioelastics, which relieve pain from the urinary tract infections, may stain the urine bright orange or blue. Make sure the client or other caregivers are aware of this so they don't become alarmed. People with kidney disorders, especially those on dialysis, take a lot of medication that's not listed here, intended to keep the body chemistry normal. The doses and types of medicines can change, often in response to frequent lab studies. Gastrointestinal systems medications. Many of these, most are familiar to you. Some you may not be aware of. Please review this list to understand the different ones. Common gastric medications include antacids and acid reducers and anti-gas medicines, laxatives, stimulants, softeners, bulk formers, emollients, and lubricants and enemas. Medicines to help digestion are given as prescribed times before, during, or after meals. Some of the medicine is given without food. You need to pay close attention to the instructions for these type of medicines. When a client is taking Reglan, be on the lookout for tardive dyskinesia, which is jerky movements of the limbs. Report this immediately to the health practitioner if you notice this. This is a medication that is recommended to be used only for a short term. Endocrine system medicines. This includes oral anti-diabetic medications used to control blood sugar levels, injectable anti-diabetic agents. Injectable medications to lower blood sugar levels come in rapid, immediate, and long-acting versions. Hormonal drugs used to treat problems with the thyroid, pancreas, ovaries, testes by regulating the various hormones. It is important that these clients take these medications at their scheduled time. Do not miss any doses. Notify the healthcare provider if the client stops taking the medications. Remember that MAPs are not permitted to assist with the administration of injectable medications. If a client is authorized to self-administer the injectable medication, the MAP may remind them that it's time to take their medication and may bring the medication to the client, but a MAP may not fill syringes, inject medications, or supervise the client who is doing so. MAPs may assist with the glucose monitoring as long as it is not associated with administration of insulin. In other words, the client needs a record of their blood sugars to keep their health to give to their healthcare provider. That is fine. If the blood sugar measurement is going to be used to calculate how much insulin the client receives, the MAP may not assist with this. Nervous system medications. Please note that many of these are utilized for more than one condition. There is an extensive list of these kind of medications. Many medications in this category treat more than one illness. You cannot assume that a person has seizures just because they're taking an anti-seizure medication. Always learn why the client is taking a medication so you will be aware of what symptoms to alert for. Some of these medications, especially the ones for anxiety, can be habit forming. Side effects of seizure or mental health medications can be dangerous. Please review this list to understand the different types of medications. Anticonvulsants are utilized to treat seizure disorders. Many of these can also be treated for psychiatric medications. Parkinson's medications are used to treat or reduce essential tremor, often utilized for other conditions as well. Psychiatric medications like antidepressants to treat the symptoms of depression, sadness, anger, irritability. Anti-anxiety treats symptoms of anxiety, excessive worry, fear, or insomnia. Antipsychotic medications decrease hallucinations, delusions, and agitation. Mood stabilizing is used to decrease manic behavior cycling with periods of depression. Side effect medications is a body's reaction to a medicine that is different from the reaction to a healthcare provider intended. Some side effects are mild, moderate, and while bothersome, can be relieved without other problems. More serious side effects, commonly called adverse reactions. Some medications cause severe adverse reactions, and these could be life-threatening. Before giving a new medication to a client, please find out what your facility procedures are for responding to changes in clients' conditions. These should tell you who to call, what to document, when to call the supervisor, who should call the healthcare professional, and when to report these changes. For the first 3 times a client takes a new medication, you should watch closely and observe them for that minimum 20 minutes for the time ordered by the physician. There are charts in the written curriculum that you'll review describing what some mild, moderate side effects suggested interventions. A chart of adverse reactions is there to understand common side effects and drug interactions. Please review this in your curriculum handouts. Allergic reactions. Allergic reactions can be mild, runny nose, sneezing, itching, nausea, vomiting, diarrhea. But anaphylactic shock is a severe life-threatening allergic reaction. Symptoms may include flushing, rash, itchiness, tingling lips, tongue, metallic taste, racing heart, dizziness, anxious, feeling of doom, swelling of the tongue, lips, and throat, difficult breathing as all air passages swell up, collapsing. Use an EpiPen if it's been ordered and available, and then call 911 immediately. MAPS may use an EpiPen even though it is an injectable medication. If a client has a severe allergy, the EpiPen should go wherever they go, and all staff should know how and when to use it when it's been prescribed by a physician. After an EpiPen is utilized, you must seek immediate medical attention for the client or go to the emergency room. Medicine error is any preventable event that may cause or lead to inappropriate medication utilization or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Medication errors are one of the most common causes of avoidable harm to patients. All MAPs are required to take an annual update course that discusses medication errors. These are the 3 most common kinds of medication errors: administration errors, dispensing errors, and prescribing errors. First, we'll talk about prescribing errors. These are errors commonly linked to the prescriber, which could be a MD, PA, DO, APRN, or DMD. Wrong drug, wrong dose, or the wrong route. Other errors include using abbreviations QD, KID, KOD, and using symbols like U for units. Or commonly mistakes are illegible handwriting. Prescribers are human and they do make mistakes. Always check the prescription order. Is it what you expected this for the client? Is the medicine you thought the client would be getting? Is it the right dose and correct for them? Liquid, tablet, or cream? Is it ordered for the correct number of times per day? Can you tell how much to give to the client? Dispensing errors. The pharmacist dispenses medications. An estimated 14% of medications have been dispensed incorrectly. Communication is the key to preventing dispensing errors. The pharmacist will receive the order from the prescriber, process the order, and delivers the order to the client or staff. The MAP must check the order against what it is dispensed to make sure the correct medication has been provided with the correct instructions. Administration errors. It is up to you. The MAP is the last person who has a chance to notice any errors and is responsible before the client actually takes the medication to make sure it is the correct medicine. As a person giving the medication or supervising self-administration of medication, the final opportunity to prevent an error will rest in your hands. The MAP must be alert to catch errors made by others and not to make any errors themselves. Picture for a moment the warning sign that you would see on the roadway as you're driving down a dangerous area that says danger. Medication errors are dangerous. Harm can range from a simple rash to a life-threatening reaction. All it takes is to cause any harm to a client is one incident. Again, take the seriousness of handling medications for the clients. Consequences of medication errors. A major consequence is the treatment is not effective and the condition of the medicine is meant to treat does not get better or gets worse. For example, Jacob has been taking a medicine, 2 tablets by mouth twice a day for seizures. Recently, he started having a breakthrough seizures and his dose was increased and had to take 3 doses by mouth, 3 tablets by mouth twice a day. When the order has been written on the MAR, an error was made. It was written by mouth twice daily instead of adding to his dose. This error cut it in half. In this case, Jacob would have a serious grand seizure while eating his breakfast and would have to be taken to the hospital. This is why a consequence can be done when a medicine error is made. Other cases could involve an overdose. These things can happen. Medication errors can cause a client to either get a lower dose, which is just as serious, of giving the wrong medication, or an overdose. Wrong medicines or the wrong dose of medication can cause nausea, drowsiness, and fainting, heart rate too high or too low. The person could have difficult breathing or their blood pressure could go up or down. Just to mention a few serious problems. People can die from medicine errors. Let's discuss the common causes of medication errors. Preparing or giving medication in poor lighting. Distractions of any kind while preparing medication and administering the medicine, which includes talking to others, including a cell phone or texting, watching TV, accessing social media, listening to music, attending to other tasks while preparing medications, cooking, laundry, or cleaning. Preparing or giving medications for more than one client at a time, not knowing the clients well, pre-pouring medications. Always prepare, give, and document medicines, one client at the time. Preparing medications early is called pre-pouring. If you have pre-poured medications for several clients, it is easier to get them mixed up when you give it to them. Distractions cause medication errors. Find a quiet place to work without a lot of noise or activity. It should go without saying, when preparing and giving medications, you should not do anything else. No phone, no laundry, no TV, no cooking, no computer work, no internet. We're going to look at this again. I know we looked at it earlier on in the class. There's the 7 rights of medication administration. Right client. Are you giving the medication to the person it was prescribed for? The right reason. Do you know why you're giving the medication? Is the reason for which it was ordered? The right medication. Is the medication you're giving the correct medication? Right dose. Are you giving the right amount of the medication? The right time. Is it time to give this medication? Is the medication supposed to be given in the morning or at night? The right route. Are you giving the eye medication in the eye or in the ear? It is important to make sure you're giving the medication the proper route. Right documentation. Did you document that you gave the medication on the morrow immediately after giving it? Yes, it's worth looking at this again and again and again. The rights of the medication administration. If any of these are not followed, a medication error is certain and harm to the client is likely. Medication error, wrong medication. Giving a medication for any reason other than the one that is prescribed for is an error. If a PRN medication is ordered pain, you may not give it for fever. Given a medication for which there is no current prescription or provider order, medications never ordered or those that have been discontinued, an unordered dose of an ordered medication. If you give another dose of a morning medication in the evening, it is a wrong medication because you have no order for an evening dose. It is not a wrong medication error if the client is given medication belonging to another client. That is a wrong person error. If a medication is not currently ordered for a particular time purpose but is given, it is a medication error. This is true even if the client takes the medication at some other time of the day, or if it was ordered for the last 10 days then discontinued. Medication error, wrong dose. Giving 2 tablets when only one is ordered is a wrong dose. Giving more than one dose of the same medication in a scheduled time period is also the wrong dose. For example, if you give a client her AM dose of a multivitamin and then another MAP arrived and gave the client her medication again, this medication is a medication error. The main cause of this is not immediately documenting on the MAR when you give medications. It is also wrong dose if you give too many or too few puffs of an inhaler, milliliters of liquid medications, inches of a paste, or if the wrong strength of a transdermal patch or the wrong strength of a suppository or rectal medications. If you do not write on the MAR when you give the medication, it is very easy for another map to assume that the medications haven't been given. Remember, if it is not written, it's not done. That is what others will assume, and your client may get the medications twice. Medication error, wrong person. The wrong person medication is when given medication to one client that is prescribed or ordered for another client is a wrong person error. This is usually caused by distraction, preparing the medication in a busy place, preparing medications for more than one client at a time, or pre-pouring medications. It is not unusual for a client to try to grab a cup of medicines belonging to another client and take them. Be alert for this. Medicine should not be left unattended. It is very important to know your client. A picture on the MAR can help to make sure you know who the client is. Ideally, the place where you prepare and give medications should be separate from other activities going on at the time. It should be a quiet, well-lit place. Working with one client at a time will help prevent wrong person medicine errors. If you're working with clients you do not know, be sure you know who you are giving the medication to. Ask them to tell their name. Avoid asking, is your name Joseph Resident? Because some people will just nod yes, even if the answer is no. Ask another staff member their name. Look at the picture on the MAR and be sure. Medication error. Wrong route. Giving medication by a different route than it was ordered is a medication error, wrong route. For example, if John is ordered an antibiotic eardrop and you put him in his eye, that would be a wrong route. Lethal medication are ordered to be given orally in crust and pudding. She does not want to open her mouth today, so you dissolve the pudding and medication in a mixture of water and give it to her in a gastral tube. That would be the wrong route error. Medications given by the wrong route can be dangerous. For instance, eardrops actually put in the eye can cause harm to the eye. Confusing ear and eye drops is the most common wrong route mistake. It helps to take a minute to think about why you're giving the medication. Look at the label, match the label with the route that's on the MAR, and catch potential errors before it happens. Confirm the client is taking the medication by the right route ordered. Medication error, wrong time. Match the time on the MAR with the time on the medicine label. Be careful to give medications labeled AM in the morning and PM in the afternoon or evening. The right time is the time that is on the MAR. To give some flexibility, a medicine may be given 1 hour before the time on the MAR to 1 hour after the time on the MAR, and it will still be considered on time. This is a 2-hour window to give the medication. Medication error, medicine not given. This is a failure to give medication for any one of the following reasons. Client refused to take the medication. MAP, or licensed healthcare professional, did not give the medication. Medication was not available. Not filling a new prescription within 24 hours of receiving it. Not refilling a current medication on time, resulting in one or more missed doses. Prescription not filled due to insurance issue. Prescription not filled due to pharmacy issue. A family error. Other, not given. Anytime medication is not given, you must document the reason why, even if it's something you had no control over, like insurance or pharmacy issues. It is still considered a medicine error. If you have a client who frequently refuses medication, start early. Remember that you have a 2-hour window to be on time. If refusal continues to be a problem, you should notify your supervisor immediately, the doctor, the client's behavioral therapist. Medication errors. There are others. Not documenting on the MAR immediately and accurately. Giving a medication by route for which you are not validated. Giving a medication that is expired or not labeled correctly. Failing to conduct an accurate medicine count for controlled medications. You must document medication administration on the MAR as soon as you are finished giving it to the client their medication. Do not wait until you have a break to document. Make sure that you write what is accurate. Make sure to check labels. If the medicine is expired or label is incorrect, it is a medication error to give the medication. We discussed counting narcotics, controlled substances earlier. This is something that must be done at every shift. If your count is wrong, it is a medication error. Medication error, what's next? Notify your supervisor as per the agency's policy. You must notify the supervisor immediately no matter what the medication error is. 2. If you gave the wrong medication or dose or the medication to the wrong client, you must call the healthcare practitioner for that client immediately. Observe the client for a minimum of 60 minutes, maybe longer if needed, and immediately report any observed changes to the client's healthcare practitioner. Call 911 if the client has difficulty breathing or other potentially life-threatening symptoms. You must call the doctor back if the client has any changes to their condition. Remember that you need to call the healthcare practitioner. You must notify the healthcare practitioner of all medicine errors with the following of 5 exceptions. Given the medication at the wrong time, not documented immediately, not documenting accurately. Given an expired or mislabeled medication, not counting controlled medications, medications given by an unvalidated map. For these type of errors, you must contact your supervisor. For any other errors except these 5, you must call a healthcare practitioner to report the error, and you must call them back if there is any changes to the client's condition while you're observing them. Medication error, calling the healthcare practitioner. For those errors that must be reported to the healthcare practitioner, you must document what they said when you spoke to them. If there is no nurse present to take the telephone call order, ask the healthcare practitioner to fax or email an order addressing the error to the client's home, facility, or pharmacy, and document the healthcare practitioner's response or lack of response to this request. If the order is to be faxed to the client's pharmacy, you should alert the pharmacy to expect a fax and keep it until it can be picked up. A map cannot take a telephone order from a doctor. You should not only document what you receive from the healthcare practitioner, you must document if you do not receive an order via fax or email, or if the phone call has not been returned. Here is an example medication error report. Please look at it and review it carefully here. This copy of the medication error report, you'll notice, is 3 pages long. The third page is for APD use. You will be looking at this piece by piece as your instructor for this course will review this with you. Let's talk about filling the medication error report, page 1. First, the discovery type. If a map or the supervisor is writing, check provider reported. This is very important. This is what you will use unless the APD or some other agency discovered your error after the fact. Secondly, you're going to indicate the date that you write the report. 3. Enter the agency provider name, Evans Group Home, and the address, and check what type of provider you are. 4. Enter your name, title, and sign. Filling out this form must be done completely. Do not leave blanks. If something doesn't really apply, write in A. Then you're going to add the names of all the staff that's involved, their title, and check whether they were validated or not. If the error was made by a nurse, you must check yes and enter the name of the nurse. Otherwise, you will check no. In most cases, you will be checking no. Enter the date of the error happened. Given the name, medication dose, time given, and how many doses were involved. Check if any of these were controlled substances. You will be checking the type of medication error involved. This is where you would check whether it's wrong medication given, wrong dose, given to the wrong person, not given at the right time, the wrong route, medication administration record not immediately or accurately documented, medication given by staff not validated as per 65G-7.004, shift-to-shift count of controlled medicine not accurate, and if there's errors that's not provided here, you would check other, and of course medicine not given, and then the reason why. It could be include failed to give, client refused medication, and others. Page 2 of the medication error report. You're going to indicate if the client was taken to the healthcare practitioner or had to go to the ER or was hospitalized. Check yes and include an explanation in the description of the incident. Also explain any other entries from page 1 in this box. If the client received more medical care, describe here. Also describe current condition of individual. And then under notification, you will check who you are notified. Continuing on page 2, the section to be completed by supervisor personnel. This is the section that's got to be completed by the APD supervisor at your facility, Evans Group Home. It tells APD what the supervisor did or plans to do to prevent an error like this from happening again. This is one of the most important parts of medicine error reporting. Understanding the causes of the errors and fixing those causes is the key to prevent future errors. Medication error reporting is not meant to be punitive. It is to help everyone understand the root cause of the error, take action to make sure the cause is looked into. Often symptoms need to be changed if they're causing errors to occur. As you can see, there are many causes. It is everyone's responsibility to work together as a team to understand what is happening and work to fix the problems. Filling out the medication error report, page 3. The last page of the report is to be filled out by APD medical case manager. Hence, the medical case manager indicates what follow-up they require. If it may be different than what your supervisor wants to do. The medical case manager will write down who is expected to be trained and by what time the training should be completed. They will list any other actions they want the supervisor to take. The form is sent back to the supervisor with an expectation that the recommendations will be carried out and the medical case manager notified when they're done. More about medication errors. If a medication error occurs in the facility, you must submit copies of the medication error reports to the facility administration and to the APD regional office within just 24 hours of discovering the error. If the medication errors occurs in a client's home and you made the error, you must submit the medication error report to the APD regional office within 24 hours of discovering the error. Following a controlled medication count, you must report discrepancy count by 5 p.m. the next business day of the discovery of the error to the APD regional office and to the supervisor of your facility. Copies of these reports are kept in the client's MAR and is also in their file and must be accessible for review at any time. No, no, no. What happens if medication refusal occurs? Clients do have the right to refuse to take their medications. This is not a medication error, but still should be documented in the client record using medication error report. The MAP should make several attempts during the medication pass to encourage the client to take their medications. The supervisor of the client's WSC should be told about the refusals. The healthcare practitioner should be notified if the refusals are frequent. If the client is a minor or lacks capacity, the guardian also must be notified. Document any notifications of client on the client's records. Frequent refusals may signal the need for behavioral consultation for that client. Medication refusals may have significant consequences. For instance, if the medications refuse controlled seizures or other psychiatric conditions, the healthcare practitioner must be notified. Medication storage may come in many forms, from a locked upper cabinet to a dedicated medical cart. The key is the medicines must be locked up at all times. Medication storage requirements. 1. All medicines must be kept centrally stored in a locked cabinet, locked cart, locked storage area at all times. 2. Controlled medications must be double locked with 2 locks. 3. Medications must be kept in the original or legally dispensed label packages, including over-the-counter medications. 4. Each client's medication must be returned to the portable or permanent storage unit immediately after medication assistance has been given. 5. Each client medicine must be kept separate from other clients' medications. Number 6, all clients' non-controlled medications should be kept together with oral medications and non-oral medications separated by using a Ziploc bag or placing in a separate container within the client's medication storage space. Number 7, medication storage areas should be free of dampness and away from abnormally warm places. In other words, not close to refrigerators, ovens, motors, or direct sunlight. Number 8, refrigerated medication must be kept in a locked container clearly labeled as containing medication or in the refrigerator of the room that is locked. Controlled medication stored in the refrigerator must be double locked. Medication keys should be held by the MAP or the nurse giving medications. If not, they should be kept somewhere not accessible to clients or anyone that's not approved to give medications. Note, if the MAP or nurse leaves the facilities with the keys, they must return them immediately. The facility must have written procedures to make medications available in an emergency if the keys are not available. This might be having a lockbox with a combination where keys are maintained, extra key maintained by the supervisor, etc. Discuss clients who self-administer medicines without supervision, how the medication is stored. Should it be centrally stored? May the MAP get the medication for them and remind them to take it. Remember, we discussed this earlier on in the class. Storage of controlled medications must be double locked. All controlled medications have to be double locked. This diagram represents a dedicated medication room or closet. The first lock of the double lock system is the locked door. Inside the room, regular prescription medications and stock over-the-counter medications can be organized. Controlled medications are stored behind a second lock of the double lock system. Our controlled medications are controlled separately in another container with double locks. Here's another diagram of a double lock system. And another diagram of a double lock system. Medication disposal. Medications that are expired or have been discontinued must be destroyed and disposal documentation of the medicine destruction record. Destruction or disposal of all medication is witnessed by another MAP or licensed healthcare professional. Both must sign and initial the form. It is important to understand medicine destruction and how it's done. Best practice is to participate in the drug take-back programs provided by your pharmacy or in your community. If this is not an option, most medications can be mixed with unpalatable substances such as coffee grounds or kitty litter or water and disposed in the trash. It is very important to remember that any controlled medications in the facility must be counted at least daily and is called for by the 65G-7 whether they are used or not. Some police departments have take-back programs. They are always available, so the controlled substances waiting for disposal will not have to be counted daily until the take-back is scheduled. Medications that are contaminated or refused after being removed from a bottle or bubble pack may be destroyed at the facility using coffee grounds, kitty litter, the same method shown above. Document on the back of the MAR that the medicine was destroyed along with the documentation of refusal and contamination. Off-site medications. At times, clients in your care may leave for several days at a time. If you or another MAP or nurse is traveling with them, you simply take the medication supplies and the MAR and give or assist with the medications you normally would. If the client is going to a family or others, you must send medications with them. Instruct the family about the medications and document on the off-site custody of the medication form. This takes a lot of planning. There are many things to consider, and having time to plan will help. There will be times, however, when you do not get much warning. Understanding the process of this particular off-site medication procedure is critical. Step-by-step procedure for off-site medications. Number one, obtain the medications needed to be signed out with the client. The entire container of medicine, bubble, a bottle of bubble back, or enough multiple dose packs to cover the time the client will be away. Medication may not be transferred to a weekly pill organizer unless the client is authorized to self-administer without supervision. If so, the MAP may not transfer the medicines or help the client to do so. Include all PRN medications unless they are stock medications that the facility provides for use of all. In that case, make sure the family knows that they have those available. If you have prior notice, try to obtain off-site medications from the pharmacy. 2. Provide a copy of the current MAR to give to the client's responsible party if requested. When the client returns, do not take back the MAR copy or enter it into the client record. Number 3. Provide the name and telephone number of the contact person at the facility and the client prescribing practitioners. Number 4. Instruct the responsible party in the correct medication, dose, time, route, as well as positioning and how to administer the medication. 5. Complete the off-site form. Each line should be complete through quantity released. Count all medications released with the responsible party. Both should sign the correct form line after counting. Give a copy of the form to the person accompanying the client. Number 6, place the original form in front of the MAR. Initial and circle dates. Doses. Client is gone. And write the reason of the medications were missed on the back of the MAR. You may use one line. All medications 51719 through 52119, home with family, would be sufficient enough. Number 7, when the client returns, count the medications back with the person. Notify supervisor for discrepancies and document them. Once all is correct or explained, the form of the back must be signed by the staff receiving the medication and responsible party. Off-site custody of medications. This is an off-site custody medication form that you see on the right. Fill it out completely, including the provider contact person and physician telephone numbers. Go over the medications with the responsible party. Count and sign the form. Make a copy of the person accompanying the client. Count and sign again when the client responsible party returns. Let us put our heads together one last time. This is the 5th class activity, and we will begin it as we see the next slide. Here is the class activity. It's all about Abby. Abby moved to the group home 3 months ago. At intake, 3 consents were filled out: consent for emergency treatment, consent to handle funds, and authorization for medicine administration. Her doctor authorized Abby to self-administer her own medications with supervision. Staff in the home are validated for oral medications only. Abby takes 4 different oral medications, 2 in the morning only and 2 3 times a day. Abby attends the day program each weekday and takes medication at 12 noon. Staff in the group home pour medication into a pill reminder daily for Abby to take at the day program. 2 weeks ago, Abby was given a prescription for an inhaler to use when she's feeling short of breath. Her doctor wants her to keep it with her and use whenever she thinks she needs it. Take a look at this scenario. What do you notice? Is anything missing? Anything wrong? What does the group home need to do about Abby? Please stop the video, work out this class activity, and then after the class activity is done, you will resume the video. Thank you for resuming the video, and thank you for attending the class. The class has been completed now, all except for the exam. Please take a short break, and then you'll take the exam for the final part of this course. Thank you again for attending the class.